Hello and welcome to this episode of Hampton Roads Business Live. Today it's my pleasure to have with me Jennifer Sherman from the Downtown Spa and Laser Center in Norfolk. Welcome.
Hi.
Hi. Why don't you give us a little bit of an overview to begin with? What is the Downtown Spa and Laser Center?
Downtown Spa and Laser Center is a medical spa, and we are part of McGee Rosenblum Plastic Surgery. We're located in Norfolk. That's why it's the Downtown Spa.
So it's a medical spa?
Yes.
Okay, well that could be important.
Mm-hmm.
Okay, that's good. All right, and what do you do there?
Well, I'm a master esthetician and certified laser technician there. I specialize in corrective skincare, and I've been there for almost 7 years.
Okay, so now I should have asked you, but before we get into exactly what you're doing, what are the general services that the spa offers?
Well, we do all kinds of different procedures. We do I can just tell you everything. We do injections, as far as we do Botox and fillers. I do laser procedures. I do facials, microdermabrasions, chemical peels, laser hair removal, laser vein removal, pixel laser resurfacing for acne scarring, wrinkles, sun damage. I do IPL, which is intense pulse light. That is also for sunspots or redness, when people have the red cheeks, red broken vessels in the cheeks, or it's also for rosacea. Mm-hmm. I also do microcurrent. That's for toning and tightening the skin, and Misa Therapy, which is for unwanted fat.
We're going to go into some of those in a little more in depth. You sound like a busy lady.
Yeah, it's a busy place.
Right. So, all right. So, when you say you're a laser technician, there's different types of lasers, right? I mean, when I think of a laser, first thing comes to my mind is Goldfinger, but that's not exactly the lasers you work with.
No.
You're working with different types of lasers for different services.
We have a couple of different lasers for skin.
Uh-huh.
So whether it's for hair or for removing tissue, we do fractional resurfacing, which is removing some of the damaged tissue. IPL lifts brown spots. I mean, so there are a couple of different settings on different lasers. Now, there are so many different lasers. Lots of doctors, skincare facilities have different lasers, and someone could come from a different office who has had laser hair removal. It's not going to be from the same laser that we had. But the settings are lasers that work with, that are looking for color. Is really that's how you remove hair and how you remove sun damage.
So it only removes certain color?
It depends on the type of laser again.
Okay.
But when you're working with, say, laser hair removal, it is looking for a dark hair in the root to remove that hair. So it's looking for contrast.
Okay,
if that makes sense.
And does it remove it by destroying it?
It destroys it, or it mutates the hair so that it can't grow normally any longer. Mm-hmm. We do laser hair removal in 5 treatments, a package of 5. Sometimes people want more than 5, but in 5 we can see the people between 4 and 6 weeks apart, so that you're trying to laser all of the hairs in the different stages of growth. Because hair doesn't all grow at the same time. You have hairs that are about to fall out, hairs that aren't there. So the laser is targeting really the color of the hair. So we can treat all different skin types at our facility. Some skincare clinics and laser clinics can only treat lighter skin types with dark hair. We can treat all different skin types, but it does have to be a brown or black hair.
Okay, all right.
Because of the contrast.
Because of the contrast.
Right.
I was just going to say, okay.
The hair needs to be darker than your skin.
All right. Okay. So let's talk about. I know you when we met a little while ago, and then just before this interview, we were talking about a number of things. So you threw out terms that they went right over my head. Let's talk about microcurrent.
Okay.
Can you tell me what that is?
Microcurrent's been around for a long time, probably 40 years. Microcurrent uses current to tone and tighten and lift the facial muscles and connective tissues.
What kind of current?
It's tiny current. It's a pulsed current. Okay. So it uses.
It's not like sound waves. It's electric current.
No, it is.
Okay.
And it uses 2 wands to lift and tone through muscle memory and acupressure points, lifting up the tissues.
Really?
So it can lift and tighten the neck, the jowls, the brow. It can lift up the eyes. It can reduce eye bags. It can reduce the lines around your mouth, plump up the lips. It's really amazing, and it's one of the things that we do at our office that there is no downtime. It is not painful. It's actually relaxing. People often fall asleep during the procedure.
How long does a procedure take?
The procedure takes about 45 minutes, but it's done in a package of 10. So the patient would come 10 times weekly. So it's a little bit of a commitment, but each treatment builds on the last. Once a week.
Once a week.
Yeah,
okay.
For 10 weeks, and then you do it once a month afterwards to keep everything where it is. Because if you think about it like exercise, if you just stopped working out, you would get flabby again. So you want to maintain where you are after those 10 visits.
All right, so that's kind of like a mini facelift?
Yes,
in a
it
way?
is.
Okay.
Yes, it is.
Well,
You
I bet
see-
that's popular.
It is very popular. You can see a result after the first treatment. I'll take a before picture and then we'll do a demo, which lasts about 30, 40 minutes, and the patient can see a difference right away.
Wow.
It's incredible.
Okay, that's...
The only patients that can't, I just want to make this clear, the only people that can't have this done, if somebody has a pacemaker, if they have metal in their neck, head, or face from an accident or something, or if they have epilepsy, they can't have it done.
Okay, all right, well, that's good to know. Now, that's not Misa Therapy, is something different?
Completely.
Okay, all right, good.
Yeah.
All right, I just had that as a second term down here, didn't know if they were joined together, okay.
Misa Therapy has also been around for a long time. It is using tiny medicinal bullets injected directly into fat to break it down and flush it out of the body.
Medicinal bullets.
Yes.
Okay.
So
What is medicinal bullets?
we use very thin, I have to stress this because people get scared about injections.
I'm scared about bullets.
No, very thin needles,
Okay.
several injections into the area at one time. So during a treatment, you could have 30 small little micro shots of the medication into your, let's say it's your abdomen, during one visit. And you come back every 3 weeks. We usually treat people from 2 to 10 times with it. And that substance, or lots of things combined, but the main ingredient is phosphatidylcholine, which is lecithin. All of the ingredients are natural. A lot of things that occur naturally in our bodies or that we take orally by supplements, they're in liquid form and they're injected into fat, and it breaks it down and flushes it out of your body. So it's a nice alternative to if somebody doesn't have, or they feel like they don't have enough fat for liposuction, or if they're afraid of anesthesia, or they don't want to spend the money for liposuction, that's what we can do instead. But it's usually best with somebody that's within about 30 pounds of their ideal weight.
All right. So in these treatments, you're taking, you're using alternative to surgery.
Yes.
To create some results that, for instance, that last one was possibly instead of going to liposuction.
Yes.
And the first one was maybe instead of a facelift.
Correct.
Initially, you might want to try that.
Right, or if you're not quite ready for a facelift.
Right.
Because our plastic surgeons will tell you, you're not really ready, you've got a little bit of laxity, but why don't you wait, come see me in a few years. That's the person for microcurrent.
Okay. That's good to know.
And if somebody just has a little bit of extra fat that they can't get rid of, it's best if somebody is already eating healthy and they exercise, and that's the ideal candidate for that.
So
Misa Therapy.
I've heard, I think it was when I was last in your center, that a lot of what you're doing is you're helping people that have maybe, like, for instance, this might be for a stubborn area they haven't been able to do anything about.
Yes.
And then you're able to target that area.
Exactly.
Okay, all right. So that's okay. That's two amazing treatments there.
Yeah, it is. It's been
Especially
around.
that first one. Well, I tell you, I'd never even heard of that.
Yeah.
So, okay.
Well, probably, Misa Therapy's been around since the 1950s, and it was really kind of discovered by a Dr. Pistor in France. They were using it they were injecting phosphatidylcholine into plaques, clogged arteries, and it was breaking them down, and this doctor got the idea, I wonder what would happen if I injected it right into someone's fat, and it broke it down. That's where it came from.
Okay. All right, so let's just go down a list of some of these that I have. We talked about the hair removal. How about the Genesis skin therapy? What's that?
Genesis is a non-ablative laser, meaning it doesn't break the surface of the skin. It is to treat large pores, fine lines and wrinkles. You can treat rosacea, redness in the skin. It is a subtle and gradual change. Also no downtime with that laser. There's no pain with that laser. It is also a color-blind laser, meaning anybody can come in and have that done. It doesn't matter if they're tan. It doesn't matter if they have sensitive skin.
Now, I was going to ask you, do any of these lasers hurt? You know.
Yes. some of the procedures are...
I didn't expect that answer.
Well, some of them are uncomfortable, and I tell patients when they come in, it is uncomfortable. I mean, some of the procedures we will put topical numbing cream. We'll put topical numbing cream for intense pulse light. It's zappy. It feels like a hot rubber band. For laser hair removal, it's a little uncomfortable, especially if somebody has a little bit of hair on their body. If they haven't just recently shaved, that's uncomfortable. Pixel is warm. It's hot. But we use topical numbing cream for Pixel as well,
okay,
for about 30 minutes. And it helps. It does help, but it doesn't, I don't want to say that Pixel hurts, because people come in and they always think that Pixel's going to hurt. It's hot. It feels like a very bad sunburn.
Okay. All right, so let's look at IPL photo
Rejuvenation.
There you go.
Yeah.
All right.
That is for sun damage.
Okay.
That's why it's called photo rejuvenation.
I see.
It's for when people have brown spots on their face, or melasma, which is like a brown mask.
You can remove that?
You can. It takes more than one, sometimes it takes more than one thing, but it takes more than one treatment, depending on the severity of it, how stubborn it is, someone's skin color. I mean, there's all kinds of factors.
Is that something when they come in to see you that you can say, okay, well, we can do this, and based on what I'm seeing here, it's going to take this many times, or you just do it and see how it works? And then
some things I will say, let's play it by ear and see how it goes. Other times I can tell if somebody has tons of sun damage, it's going to take more than one treatment. I just know. Right. Or if they have a lot of redness, broken capillaries through here. Some people have the red nose, the red cheeks. That's going to take more than one treatment every time. Right. Now, you might need it once now, and maybe 3 months later come back and do it again, but usually that's going to take more than one treatment.
I see. Okay, now here's one that I'd like to hear about. Laser vein removal, and because I can picture laser hair removal, I can't picture laser vein removal.
That is for spider veins, and normally I will either treat the little purpley vessels around the nose. Sometimes someone will have them in the face too, which is, I may combine that treatment with IPL if it's in the face. But typically the laser vein removal is for leg veins. It's for spider veins around the knees where people cross their legs and they have them in their ankles. It's for purple or reddish veins. It coagulates the blood, and then it's absorbed by healthier vessels surrounding it.
So the vein just disappears?
Yes, it takes time. It doesn't happen instantly. I can see a change instantly when I'm doing it, but it will fill back up with blood. But you're trying to destroy that broken vessel and redistribute the blood into healthier vessels. And it takes about 4 weeks to see a result with it. It usually looks worse before. I can't stress this enough. When people come in, they always come in like April or May. They should come in the winter, because you do a treatment, it looks worse. The veins are swollen or welted in the area that I treat, and then you have to come back in 6 to 8 weeks, and we may have to do another treatment. So that is not a treatment to do in the spring or
so
summer.
You don't want to do it right before you.
No, and that's when people start thinking about it, because they're wearing skirts and shorts.
Right, okay. Another one here is the Pixel you mentioned.
Pixel is our fractional laser resurfacing.
Right.
That is for fine lines and wrinkles. It's for acne scarring. It works excellent for scarring, acne scarring or otherwise. If someone has a scar from, our plastic surgeons do most procedures where they remove skin cancers, and it'll leave a scar. Sometimes we can go right over that with Pixel and fix the scar, or greatly improve the scar.
What does that actually do to the scar?
Well, you are using heat, you're removing some tissue with the laser, but it's also thermal. There's a thermal effect where it goes deep inside the tissues, and it is creating you are creating a wound that's going to create new collagen. Anytime you inject or you create a wound with a laser, you are going to produce new collagen to heal. So that's how it improves scarring and wrinkles, because you're going over that, you're creating a wound, and you are healing with new tissue. You have new tissue underneath. That's a lot of what we do at the Downtown Spa and Laser Center.
And that does that come up when you're talking about chemical peels?
Absolutely, yes.
That's what I was thinking.
Yes.
Because now, does chemical peels hurt? It doesn't sound good.
It doesn't. It's not what you think. They're hot, but they're hot for about 2 to 3 minutes, and then we, rinse it off. We do a couple of peels there that you leave on the skin. We do the VI peel, which has become very popular. You leave that on the skin and wash it off at home. That stings for, I swear, 20 seconds, and then it's over. We do a couple of peels where it's hot for a couple minutes, and then it's over.
Okay. And so
The peeling part does not hurt.
Well, okay. Good. well, I'm just not familiar with any of this, so this has been very interesting to me. I don't know anything about it. So let me ask you, if you had someone come in, what is some of the everyday advice that you give to people about taking care of their skin? I mean, you give people advice on that, right?
Yes, I would tell people not to wait until they're 60 or 70 to start taking good care of their skin. Everybody should be using a good sunscreen. They should be using good products, and by good products, I mean products that you purchase at a dermatology office or at a skincare clinic like ours. Good quality products, because even if you buy things from Nordstrom's or Macy's, they're still over-the-counter products, and they're just a superficial moisturizer that's really not doing anything to benefit your skin. They cannot, by law, have the active ingredients that you can get at a skincare clinic. So
Okay.
that's
Well,
important. Everybody could benefit from microdermabrasions and chemical peels. That is an inexpensive and easy thing for almost everybody. If somebody has very sensitive skin with a lot of rosacea, maybe not, but almost everybody could benefit from microdermabrasions and chemical peels, and using Retin-A when we start to get a little over 30, a little bit older, to keep your skin exfoliating and keep it healthy and looking dewy and fresh. Those are really important things that people, I don't think they know. There are a lot of over-the-counter products that say they have these things in them, but they're just not strong enough to do the job. So.
Okay, and so you see all kinds of people then. I mean, you don't really
yes.
have a typical.
No, we see all kinds of people, and some people will save. Another misconception is that people think that these things are very expensive, and they're not. You can start small. We have treatment plans with people. If they want to do A, B, and C, we can go from 6 months to a year, and start with the most important thing, whether it's sun damage or hair removal. I mean, we've had some patients for years that started with one area of the body and have just moved around to other areas, because you can't do everything all at once. Most people can't afford to do everything all at once, but the treatments that we do are individually are not expensive.
Right. Okay. And so, if someone is thinking about this, then what's the process? Do they call your office to make an appointment with you, or
yes, they can call our office.
Is it a consultation?
It's a free consultation.
A free consultation.
Yes.
Okay.
It's a free consultation for just about anything at our office, for fillers, for Botox, for skincare with me, for laser, with the doctors as well. And if somebody has concerns that maybe I can't help them with, we have other people in our practice that can.
Right.
So that is a huge benefit of working with, a dermatology PA and plastic surgeons. We all help each other, and we
So
can
you got
all
it all covered.
Yeah, we do. Yeah, but we have a Facebook page and Downtown Spa and Laser Center, and we offer specials all the time. If you come in or if you give us your email address, we send out specials all the time.
Okay, well, that would be a good thing to do.
Yeah.
Okay, is there anything I didn't cover?
I don't think so. I don't think so.
Okay, well, we touched on an awful lot of things here. All right, well, if you have a need for spa or some of these skincare treatments, or you'd like just a consultation and to find out what you might be able to do, you might be surprised. Contact the Spa and Laser Center. They're a full medical spa in connection with McGee Rosenblum Plastic Surgery. So they have from one end of the spectrum to the other covered. And you can give Jennifer a call. Her contact information is at the bottom of this page and at the end of this video. And we thank you very much for coming in and being with us today. And I wish you a lot of success and very interesting interview. I learned a lot.
Thank you very much.
Thank you.